my water just broke. I felt like things really intensified.
She was right there and she was coming.
It was an amazing feeling.
I'm going to cry just thinking about it. I could feel her head.
We heard her cry. We were squeezing hands and she was screaming.
I'm Bryn Hunt Palmer, and you're listening to The Birth Hour. This podcast is designed as a safe place to come together and share childbirth stories. Stick around and join us to hear informative and empowering birth journeys from all over the world. Today's episode is sponsored by Zenith Health. Navigating pregnancy can be overwhelming, especially when it feels like everyone has an opinion, not to mention the late night Googling and social media rabbit holes we've all found ourselves in. Zenith Health helps you navigate pregnancy with access to real evidence, bringing you peace of mind through data. Imagine if your Google searches only returned answers based on real evidence from research studies, clinical guidelines, and physician-authored content. Instead of giving you more opinions, Zenith's Pregnancy Evidence Navigator, or Penny tool, provides exactly that, and it's completely free to use. Next time you have a burning question like a new symptom, a supplement you're unsure about, or a question as you're planning for birth, spare yourself the panic Google and ask Penny your question for a real-time, unbiased review of the evidence at www.zenithhealth.io. At the same time, what really excites me about Zenith is that they've also started the Pregnancy Evidence Project, which is the first large-scale research project wholly focused on learning from the millions of pregnancy and postpartum experiences already happening in the real world. If you choose to opt into this, your pregnancy journey becomes part of the evidence that helps future moms make informed decisions and drives research forward. I'll be discussing both Penny and the Pregnancy Evidence Project in depth with the founder of Zenith, Abigail, at the end of this episode, so stay tuned for that conversation. We would also love to welcome you into our listener supporter group via Patreon. That's at patreon.com/birthhour. And by becoming a Patreon supporter, you get access to all of our archived episodes. This podcast launched in 2015, so we have over 800 episodes in the archives that are not in the main podcast feed, so you can get your fill of birth stories. And you'll also get access to our private Facebook group for Patreon members, which is a great place to honestly just to search the past posts to get answers to questions, but then of course to ask new questions, find community. It's a really, really great supportive group of people. So I highly recommend joining that. We would love to have you there. We also do monthly Zoom calls with our Patreon supporters, and you get an opportunity to enter your birth story via a different submission form than everyone else uses, and we choose 2 Patreon members each month to share their birth stories. So that is again at patreon.com/birthhour. And of course, I have to mention our Know Your Options online childbirth course, which started just a couple years after the Birth Hour started, and it's really grown into an amazing community. You get lifetime access with that. So we have members returning for subsequent births and things like that. For the content of that course, I partnered with my friend Stephanie, who is a childbirth educator. She's also a birth and postpartum doula, a lactation consultant, and now a sleep consultant as well. So she has so much knowledge, and she really believes in evidence-based teaching. And that's been the whole goal of that course. So I'm grateful to everyone in that community. I know I'm not as active on social media with my personal life now that my babies are a little bit older, but if you want to get to know me more, I'm in those communities all the time. I'm on the Zoom calls every month, and I just love having that personal connection with the Birth Hour community. Today's birth story guest is Hannah, and she has 3 birth stories to share with us. The first was an epidural birth, followed by 2 epidural-free inductions. She also dealt with an IUGR diagnosis, intrauterine growth restriction, as well as newborn viral meningitis. So she talks about what postpartum was like with that. All right, let's hear from Hannah. Hi, Hannah. Welcome to the Birth Hour. Thank you for coming on the podcast.
Hi, thank you. I'm so excited to be here.
Awesome. I know we have several stories to get to today, but before we do that, can you tell listeners a little bit about you and your family?
Yeah, absolutely. So I have a husband named Quentin, and we got married in 2017. And then we have 3 girls. We have Nora, who is 5, Rose, who's 3, and then we have a little 7-month-old baby, Meredith. And then we have a crazy dog and a cat as well.
Awesome. All right. Well, we're going to hear all 3 birth stories today. So why don't you just start us off with your first pregnancy, whatever you want to start with there.
Okay, perfect. So as I said, my husband and I got married in 2017. And we took some years just for it to be the two of us. And we always knew we wanted to have children, but we really wanted to pay off our student loans first. So we did that. We're both nurses. So around 2019, we decided that we wanted to start our family. And as we all know, what happened in 2019 and 2020, COVID began. And so I had stopped taking birth control, but we actually both worked in the ICU. And COVID had started, and we were both working very closely with COVID patients. And so, at the time, they didn't know how COVID affected pregnancy. So we had briefly thought about maybe just waiting to start our family, but we had decided to go ahead and start trying. And we were very lucky. We didn't have to try for very long. But when you want to get pregnant, you want to get pregnant like yesterday. And so I knew that I had been on birth control for so long, and I had stopped taking it in that December. And then in January, we had started trying, but I didn't really know like what a normal cycle was for me. So, we were trying like every 2 days. It was like we were on a mission. I was on a mission to get pregnant. And I knew that I was kind of supposed to be starting my period soon. And my breasts were so tender. And I had taken a pregnancy test and it came back negative. And I was having some cramping, and I was like, oh my gosh, like this is just going to be a really bad period. Like I hadn't had a normal period in so long, but I was like, gosh, this is terrible. And so my husband was like, Hannah, like your boobs are huge. Like you need to take another pregnancy test. And we had worked night shift at the time, and we were both supposed to be working in the COVID ICU that night. And I was around like March of 2020. And I took a pregnancy test and it came back positive. We worked night shift, and I had to leave for work at like 6:30. And I think it was like 6 p.m. when I got a positive pregnancy test. And we were so excited. And I called my manager right away, and she moved me off of the COVID ICU. So that was nice. And then my job actually moved me away from patient care, and I worked virtually my entire pregnancy. So that was really nice. I had a great pregnancy with Nora. I was just so excited to be pregnant. I didn't really have any symptoms, hardly at all. I actually wanted to be nauseous. It made me nervous that I wasn't nauseous. And because I didn't think that the pregnancy was healthy, but my main symptom, I was just tired. But other than that, I felt great. I was thriving. And I had planned a hospital birth. My older sister had went to a local OBGYN, and she had a really great experience when she had her kids. So I decided to use the same OB for my pregnancy. And I had a really great experience with them as well. I had my 20-week ultrasound. Everything went great with that. And we found out we were having a little girl, and we had a little gender reveal, and that went great. We ended up having a baby shower, and my whole family got COVID from this baby shower. And I was about 32 weeks pregnant. And luckily, my main symptom was I just had a cold. I didn't really have anything else. And my OB wasn't too concerned. Interesting enough, I healed and I was fine. But when I went in to have the baby, they were doing COVID testing, and I was still testing positive for COVID, even 6 to 8 weeks later. I thought that was really interesting. But that brings me to the birth story. I had my 39-week appointment, and my husband had just worked night shift that night. And my appointment was in the morning. It was like 9 o'clock in the morning. And my husband was like, should I go to this appointment with you? And he had been able to go to my appointments with me most of my pregnancy. COVID had not gotten in the way of that. And I was like, you should just go to sleep. It's going to be fine. I'm not going to have a baby today. I feel great. And so he was like, okay, I'm going to go home and go to bed. And so I went to my appointment, and they took my blood pressure, and it was elevated. I think it was in the 150s. And I knew what that meant. And I was just really scared. And I started crying, and my OB came in, and he checked my reflexes, and he looked kind of to see if I was swollen. And I was a little bit swollen, but I think I was 39 weeks and 3 days. And so he said, I'm going to send you over to labor and delivery, and we're going to induce you. And so I was really upset about this, but I was planning a hospital birth with an epidural. That was my plan the whole time. And with me being a nurse, I was like, I don't need to take any classes. I know everything. So I didn't take any pregnancy classes or birth classes, none of that, no breastfeeding classes. I was very, very underprepared, to come to find out. But I was very upset. He sent me over to labor and delivery, and I called my husband and he wouldn't pick up the phone. Wouldn't pick up the phone because he was at home sleeping. So I called my sister and she had to go and wake him up and bring him to the hospital so that they could start the induction. But they got me all settled into my room, and my nurse was so kind. It was a great experience. They placed the IV and they asked me my birth preferences, and I had told them I wanted to have the epidural. They checked how dilated I was, and I was about 1 centimeter dilated. And so it was probably around 11 a.m. They started the Pitocin, and I wasn't really feeling any contractions at all. I remember my husband and I were just so excited, and we were just I was bouncing on the ball that was in there, and they gave me some popsicles, and we just kind of spent the day like that. They kept bumping up the Pitocin, I think like every 30 minutes to an hour, and I had the monitors on, and it was fine. And then they did shift change, and the night shift nurse came in. Her name was Teresa, and she was just wonderful. And she had asked me if I wanted to get the epidural yet. And I was having like mild contractions, but nothing significant, or like it wasn't hurting or anything like that. And so then it was around 9 p.m. and I still wasn't really hurting that much, but I was like, okay, let's just go ahead and I'll just get the epidural because I kind of just want to go to bed and get it over with. So the anesthesiologist came in and he gave me a wonderful epidural. People had explained that it kind of felt like a bee sting, but I didn't even think it hurt that bad. It was like maybe a slight pinch, and he was a super nice anesthesiologist, and my husband was able to stay in the room. But later he told me he had regretted seeing the epidural because it kind of freaked him out, even though he's used to seeing stuff like that being a nurse as well. But I liked my epidural because I didn't feel any pain and I could still kind of move my legs. So I wasn't like so numb that I wasn't able to move anything. And I liked that. And so I tried to take a nap, but I was just so excited I couldn't really nap. And then around midnight, they came in and they did a check. And the nurse said I was 10 centimeters dilated. And I was so excited. I thought we were going to push the baby out. Like I thought it was time to go. And the nurse looked at me and she said, okay, do you want to push for a long time or do you want to push for a short amount of time? And I was like, well, I would like to push for a short amount of time. And so she had me do something called labor down. So she kind of put me in this like sitting upright position in the hospital bed. And my legs were like kind of bent up. And I just kind of sat there for like 2.5, 3 hours. And so what I think ended up happening is I was 10 centimeters dilated, but I think the baby was still really high up and not really engaged yet. And so I sat like that for a little bit, and then my sacrum and my hip bone started hurting really, really bad. It was like 3:30 in the morning by this time. And it felt like there was so much pressure on my hip bone and I was getting really uncomfortable. And so I called the nurse in and I was like, my hips just hurt so bad. And she said, oh, yep, I think it's time to push. And she was like, I could tell by the baby's heart rate that things were changing. And she checked me and sure enough, the baby was like right there. And so we did a couple practice pushes and she was like, okay, I'm going to go get the doctor. And it was really nice because the doctor that I had been seeing my entire pregnancy was the doctor who was on call that night. And so I really appreciated that. And we had a really good relationship. And I could tell he had been sleepy. And so he came in like kind of disheveled and like half awake. But they said, okay, Hannah, you can push. And I pushed for about 45 minutes and I could feel my contractions a little bit to help assist with the pushing. And I knew when they were coming. And then right towards the end, my contractions kind of stopped. And the doctor said, this is normal when the baby's about to come, that your contractions can kind of slow down. And by this point, I was getting so tired. My arms were starting to shake and I just wanted to be done with pushing. I didn't really like it. And so I gave like a couple of last pushes and I had asked for a mirror and so I could see the baby come out. And my husband told me that he was really disturbed later on because when the baby was crowning, the nurse was taking her finger and twirling her finger in the baby's hair while the baby was still inside of me. And my husband was like, oh, it was, I did not like seeing that. It was kind of disturbing her. Like, and she was like, oh, she has so much hair. And she was like twirling her hair like while the baby was inside of me. But I was just really excited that the baby had hair because I always...
Yeah. You're like, tell me more.
Yeah, I was like, oh my gosh, thank God my baby has hair because I really wanted baby that had hair. And I could see it in the mirror too, which I liked the mirror. But, I was pushing so hard though that I didn't really see the baby come out because I had my eyes like squeezed shut. And so they said, okay, Anna, push your baby out. And so I pushed her out and she came right up on my chest. And it was just the greatest feeling. And we did skin to skin for a while and we were crying and my husband was crying and it was just great. It felt like euphoria. Like I was just so excited. One, that it was done. And then two, that like I had my baby and everything went great. And I don't even remember delivering the placenta. Like I was just I didn't feel anything. I was just so busy admiring my little baby. And it went really great. I had a 2nd-degree tear, and so he stitched me up. But even that wasn't too bad. And then I wanted to, I didn't do skin to skin for an hour. And looking back, they had phrased it in a way. They were like, oh, Hannah, do you want us to see how big the baby is? And I was like, oh, well, yeah, of course. So I wish I would have done longer skin to skin with her. But they took her over, weighed her and did everything. And she was perfectly healthy. And we had a great postpartum experience. I had a little bit of anxiety, but I was just so happy to be a new mom that it was just like wonderful. And that kind of concludes my first birth story.
Yeah.
It was great. We were able to, breastfeeding was so much more difficult than I thought it was going to be. And I wish that I was more prepared for that. Like I thought it was going to be this like natural thing where you like put the baby on your breast and it just works. And, I was like, cave women could do it. I can do it. But I remember like looking at the board after I'd had the baby and it was like nurse the baby every 2 to 3 hours. And I was like, oh my gosh, like I didn't even think about that. I knew that I wanted to breastfeed, but I didn't even really think about feeding her when I was pregnant the entire time. And so luckily my sister had breastfed 2 babies at this point. And so she was super helpful in nursing and latching and helping me with that. And so we went on to breastfeed for about 15 months. And then that's when I got pregnant with my second little girl named Rose. We knew we wanted to have more kids. And so I did not go on birth control, but we had like a little oops, which I don't know if you can, I say it was an accident, but if you're not preventing it, then it's really not an accident. And so I didn't really think anything of it. I knew we had an accident, but Nora was about 12 months old. She had just had her first birthday. And so I kind of stopped thinking about it. And then a couple weeks later, I was cleaning out my junk drawer and there was like an unused pregnancy test that was in there. And I was like, oh, like, what? Maybe I haven't had a period in a really long time. Like, maybe I should take this. And so I took it and I set it on the table and I kind of forgot about it. And then, I don't know, I think I was feeding my daughter lunch and then I was just walking around the table and I looked at it and it said pregnant. And I was like, oh my gosh. And I just started screaming and I was so excited. And then my daughter was in her high chair and she was looking at me like, what is going on, Mom? But my husband was at work and I was like, I cannot wait to tell him all day. And so I FaceTimed him and told him that I was pregnant over FaceTime. And he was like, oh my gosh. But we were really excited. We were really happy. But I typed in my phone when our due date was going to be. That was like the second thing I did was I need to know when my due date is. And when I just typed it in some random app and my due date was September 3rd. But that was also the same day as my little sister's wedding. And I was supposed to be the maid of honor in my little sister's wedding. And she had this wedding planned for like already a year now. And the wedding was going to be like 3 hours away. So I was like, oh my gosh, my due date is on my little sister's wedding day. But we were so excited. We told all of our family. They were really excited for us. We decided to do the blood test this time to find out the gender. And I thought it was kind of fun when the blood results came back with the gender. My husband was at work and we had wanted to find out together. And so I asked the nurse if she could just call back and leave a voicemail telling us what the gender was. And then later on, when my husband got home from work, we were able to listen to the voicemail together and find out that we were having a girl. And I still have it saved on my phone. She was like, drum roll, it's a girl. And so that was like a fun way to find out. But again, I had a really great pregnancy. My main symptom was that I was just like so tired. And I always felt really guilty because I was just trying to be like a good mom to this 12-month-old little toddler, and I was just so tired. I wish I would have given myself a little bit more grace and just like sat down and relaxed. But again, the pregnancy went by really fast, no big issues. Because I had had preeclampsia in my first pregnancy, they had me take aspirin my second pregnancy to help avoid preeclampsia. And so I had planned a little bit different of a birth this time, though. I loved my epidural birth and I had a great experience with the epidural, but I didn't really feel any contractions. And I really just wanted to experience what birth felt like. And so my plan was to have an unmedicated birth. And my sister had just had her third baby and she had an unmedicated birth and she just had like a great experience with it. So that was my goal. I really wanted to avoid an induction because I knew that having an induction might be a little bit harder to have an unmedicated birth, just because I had heard, Pitocin contractions were really painful. And so in order to prepare for that, I listened to a lot of the birth hour. That's when I really started listening to the birth hour. And then I would watch some like YouTube videos on other people who had natural births. And then I talked to some of my friends who had also had unmedicated births, and they gave me some of like their coping mechanisms. But I was nearing my due date and I was nearing my sister's wedding. And I still had not had the baby. And so on my due date, still no baby. And my husband and I decided to drive the 3 hours and go to my little sister's wedding. And so we went to that and we were supposed to stay the night in a hotel, but I was just like wanted to get home because I was really nervous I was going to go into labor. And then that Monday I had an appointment with I chose the same OB and she checked me and I wasn't dilated at all. And she told me that I should try walking around the mall. And I was really upset because I was like, I chase after my toddler all day and you're telling me to go like walk around the mall to help my baby engage. And so, I was like 40 weeks in one day, I think. And they were like, we really don't want you to go to 41 weeks. That's kind of our cutoff. And so they had scheduled an induction for, I think I was like 40 and 5. And so I was kind of bummed because I really wanted to go into labor on my own too. I just thought that would be something that would be fun to experience. And so my induction day rolled around and they were going to have me come in the night before because I wasn't dilated or effaced at all. And they were going to give me a cervical ripener. And so I was with my toddler all day and she had developed a fever. She wasn't like super sick, just a little bit of a fever. And so, I didn't really think anything of it. We took her to my sister's house and we went in for the induction. So that night they started giving me the cervical ripener called misoprostol, and they inserted it like vaginally every 4 hours. And I got my first dose around like 9 p.m., I think it was. And then again, I got it around 1 a.m. And when she checked me at 1 a.m., I was like 1 centimeter dilated, I think. And so they gave me another dose. And I just remember the hospital bed was so uncomfortable. I couldn't sleep just because it was just, the bed was so uncomfortable. So then it was around 3 o'clock in the morning and I started feeling contractions. And so I pulled out my app timer and I started timing them. But then I was like, this is silly. Like I'm in the hospital. I don't need to time my contractions. And so I noticed that if I laid on my side, the contractions went away. And so I was like, I was going to try and sleep, but then I was like, I'm in the hospital to have a baby. Like I want the contractions to come. And so they just felt like little waves. They weren't painful. And I know people sometimes say like, it feels like period cramps, but I didn't really feel like they felt like period cramps. It was just it almost just felt like Braxton Hicks that were, happening every like 3 minutes. And so then it was around 5 o'clock in the morning and she checked me again and I was 3 centimeters dilated. And so after 3 centimeters, they can't place the misoprostol anymore. And so she told me that she was going to call the doctor and see if they wanted to start the Pitocin. And so by this point, I was like, I just want to get out of this bed and like walk around. And so I got up and she came in and she said at 7 a.m. they were going to start the Pitocin. So I was like, okay. They started the Pitocin around 7 and I would just stand at the bedside. And every time I had a contraction, I would kind of squat with the contraction. And I brought a comb with me. And my friend had told me about this, that when you had a contraction to kind of squeeze the comb in your hand to help with pain. And then another thing that I really focused on was having like a relaxed face. I think I had heard that on one of your birth hour stories that, if you can keep a relaxed face, then it can help to relax your entire body. And I just tried to let the contractions like do what they needed to do. And so I did that for a couple hours and it was around 8:30 in the morning. My doctor came in and he said, okay, I'm going to break your water. And by this point, the contractions really weren't hurting that bad. I remember looking at my husband and I was like, this doesn't hurt at all. Like, this is great. Like, I'm having such a fun time. And so he broke my water and he said, the baby is really engaged. And when they broke my water, none of my waters came out because he said that the baby's head was so engaged that all the bag of water was like behind her head. And he said that I was 6 centimeters dilated. And I was like, oh my gosh, this is wonderful. Like 6 centimeters. I can't believe I made it this far. I was just like so excited. And the nurse had me put on like basically an adult diaper. And then I stood back up and I think I had 2 or more like kind of fine contractions. And then on that third contraction, like everything changed. I was eating my words when I said that this was not hard and not painful because it definitely got more intense. I started to get like hot and sweaty and I could feel where my uterus was. And it felt like someone was stabbing me in my intestines, or like the worst diarrhea cramps of your life is like what I was trying to explain it to my husband. But I still tried to squat into the contractions, and every contraction I had, like gushes of water would come out, and it just felt very strange. So then I remember my husband was by me and I was just getting like so hot and just like, I didn't want anything touching me. I didn't want my husband to touch me. I didn't want my gown on anymore. I didn't want the blood pressure cuff was on me. And I told my husband to go to the other side of the room. I was like, leave me alone. Go to the other side of the room. And I had this like wave of nausea and that was it. I didn't puke or anything like that, but just this like wave of nausea. And I was like, oh my gosh, like, I don't know if I can do this anymore. And so I was standing there and I had a huge contraction and I started to feel a like burning sensation. And I was like, I think this is the ring of fire. And I was like, Quentin, I think you need to call the nurse in here because something is burning down there. Like it burns. And then my contraction went away, but it was still like kind of burning a little bit. And so the nurse came in and I was like, it's just burning, like something's changing. And then I had a huge contraction standing there and it like, I could feel the baby dropping and like coming out. And simultaneously I pooped. And it was the weirdest feeling to like have zero control over your body. But like as the baby was coming out, I was like pooping. And so I'm like screaming because I'm like, what is happening? It's so painful. And so they kind of guide me over to the bed and she rips off my Depends and the baby's head was crowning. And so then it was like,
oh my gosh.
Chaos. Yes. It was just like chaos took over. There was like so many people in the room and I'm like concerned that I pooped. So I'm like, I pooped. And my husband's like, it's fine. And I think he cleaned me up. And I just had like wires wrapped all around me because I just kind of like dove into the bed. And so they're calling for my doctor. So at that time, my OB he was in the clinic. And so, but I really wanted him to be there for my birth. So the clinic is attached to the hospital. And so they called Dr. Perry and, they told him to come over and they were like, we have a baby. She wasn't out, but they could see her head. And so everybody was in there just like trying to get things ready. And, it's just the weirdest feeling because in between contractions, there's no pain and it's fine. But then, and I was just kind of laying there, but then the contraction hits and I was like screaming. I was like thrashing in the bed. I'm like begging for Dr. Perry. I'm like, where's Dr. Perry? And so finally he walks in the room and I'm like, oh, thank God you're here. And he said, okay, Hannah, you can push now. And I said, what do you mean I can push now? Like, I've been pushing. And so I think I gave like one push. And then he said, okay, Hannah, push again really hard. And she came out and it was just the greatest feeling I have ever felt. And she came up on my chest and she looked just like my firstborn. I couldn't stop talking about how much she looked like my first baby. But the biggest feeling I felt is like while she was coming out was just the ring of fire. Like it felt like my legs were on fire. I couldn't get over how hot my legs were and how much fire was coming out of me. Like I wanted them to take my socks off because I thought that would make the ring of fire feel better. That's like the only sensation I could feel. So I made sure this time I wanted to do more skin to skin with her. They had asked if they could weigh her. And I said, no, I want to keep holding her. And so I kept holding her and I did some skin to skin with her and she latched right away and was nursing so good. And we just kept holding her. I remember the nurses checked her over and I remember one of the nurses said, okay, I'm going to look at her hands and her feet. And I said, okay. And so they did that and everything was fine. And then my husband and I were just kind of looking at her and we undid the blanket and we looked at her foot. And at first I thought her little toe was broken because it was like completely crooked. And I was like, oh my gosh, does she have a broken toe? And then we looked again and she had actually had an extra little piggy toe. And it had a toenail and everything. And so we were like, oh my gosh, like my baby has an extra toe. Like, and the nurses are like, oh no, this is completely normal. And I'm like, my baby has an extra toe. Like, you cannot tell me that's normal. But they said it happens like all the time. And so I'm thinking it's like the biggest deal. And I'm like, we need to take her to like a specialist. And the nurses were like, no, like the pediatrician can take care of it. Like they just kind of tie it off and it just falls off in a couple days. And I'm like, absolutely not. Like they're not doing that to my baby. So then I talked to the pediatrician and the pediatrician was like, listen, if you can take the baby somewhere else, but they're going to charge you a lot of money. She was like, if you get it done here at the hospital, it's only going to be like $100 to get her toe taken off. So the next day I was like, okay, you can take her. And I had called her actual pediatrician and the pediatrician said the same thing. Like, it's okay if you want to take it off in the hospital. And so it was weird though. Like it actually had a toenail and it looked like a full extra little piggy toe. And we called her name was Rose. So we were calling her Rosie Toesy. And she still has that nickname. And her sister and her older sister and cousin, they thought it was so funny that she had an extra toe. But then the next day, so they went and they were going to try and tie it off, but they had said that it was too thick to tie off. So they actually ended up like cutting the toe off and put like 3 stitches in. And so, yeah, someone had actually told me like, oh, you should just keep it there. I was like, I'm not going to keep an extra toe on my baby, but that's not happening. But yeah, it was great. And then we got discharged from the hospital. I felt great without having the epidural. I was up and walking, and I just had a minor, first degree tear. It was not bad at all. And so then we went home and I had a 22-month-old at this point, and I just felt so guilty, not giving her all of my attention. And she was still sick. And so, and she still had a fever, so she didn't feel good. And I was just crying. It was just the hormonal and the lack of sleep. And then the hormonal shift my second time around was just so much harder. And I just felt so guilty not being there for my older daughter. And then nobody warned me about the second night of life. So I guess there's this thing where when a baby is born, their second night of life is they're up all night. And that turned out to be the case with my second. She just wanted to nurse and nurse and nurse and nurse and nurse. And I don't think I slept at all. And so then we took her to a pediatrician appointment and everything went fine. But I had mentioned that my older daughter was sick. And so she said, just don't let her cough in the baby's face and wash hands and things like that. And so I'm like, okay, I'll do my best. But like keeping this 1.5-year-old away from a baby is like virtually impossible. And so on her 5th day of life, I went to nurse her at night and I noticed that she was very warm. And so I took her temperature and sure enough, she had had a fever. And so with newborns, they consider a fever over, I think it's 100.4, and you're supposed to take the baby into the ER. And so I was like, okay, we got to take her in. Because the fear is that they could have bacterial meningitis, which would be very, very dangerous for a baby. And so they kind of have the same protocol for all babies that come in with a fever. And I had figured, oh, well, she's probably just sick and has the same thing that my older daughter does. And everybody else kind of agreed with that, but you still have to go through the same protocol. And that protocol is a lumbar puncture, which a lumbar puncture is where they take CSF fluid from your spine through your back. And so they had to do that to this little 5-day-old baby. And that was horrible. And they had to place all these IVs and do blood cultures on her. And they started antibiotics on her just in case it was bacterial. And so that was horrible to see. Like they had a hard time getting the IVs in. And just seeing your little baby so helpless and crying was just really difficult. And so we automatically had to stay for at least 2 days to get the antibiotics and to wait for all the cultures to come back just to make sure it wasn't bacterial. But the baby was doing great. She was still nursing. She still had a fever, but other than that, she was doing really, really well. And so on the day that we were supposed to go home, I was really optimistic that, we were just going to go home. It was going to be great. On the day that we came home, her lumbar puncture that they did ended up showing that she did have a viral meningitis, which they explained to me that she just has the same virus that probably Big Sister does. And, because she doesn't really have an immune system, it went to her cerebral spinal fluid, but she's going to be totally fine. And I was like, okay, great. But they were like, we still need to wait for the rest of the cultures to come back. So then a couple hours later, the doctor came in and she said, I have some bad news for you. And she said, the lumbar puncture that we did is growing a bacteria, meaning that she has bacterial meningitis. And she said, we're going to have to put a more invasive line in her. She's going to have at least 6 weeks of antibiotics, and we don't know what her life is going to look like. And this can be a very devastating diagnosis. And so at that point, my husband and I our knees just hit the floor. They're telling me that my little baby who, I thought was just had a little fever now has this horrible bacterial infection. And she said, I'm going to talk to our infectious disease specialists and, we're going to figure out a plan, but it's not looking good. And so, we were just in shock, right? And then 20 minutes later, she comes back in and she said, I talked to the infectious disease doctors and they don't think that this is real. They think it's a contaminant, meaning that when they took the culture, they accidentally got bacteria in it. And the bacteria, it could have came from they didn't clean the site properly. It could have came from the lab, but basically they were your baby does not have bacterial meningitis. And so, at that point, I just couldn't stop crying because I'm okay, I'm so thankful that my baby's okay, but you just told me she was basically, we don't know what her life's going to look like. So I think I spent that whole day crying. So, they said she does not have bacterial meningitis and that she's going to be fine and that we can go home the next day.
Oh my gosh, that's a lot to go through.
Yes, it was so much to go through. And so, but that kind of marked the beginning of the downfall of my mental health. I was just so anxious about everything. And I just was worried about everything, crying all the time. I had a really hard time balancing my toddler and the baby and just overwhelming guilt. And my sister was telling me, Hannah, I think you have postpartum depression. And I was like, no, I have a reason to cry. it's not postpartum depression, blah, blah, blah. So then at around 4 months, it came to a head and I was like, I need to do something about this. So I did start taking an SSRI prescribed by my doctor, and that changed everything for me. And, I was not enjoying being a mom prior to that. But after I started taking the medication and it kicked in, I felt so much better, and I just thoroughly enjoyed life and like baby. And it was life-changing for me.
Good.
And so I'm very thankful that I had a good support system. My husband was so supportive. My sisters were so, so supportive. And, they just let me talk about my feelings and my emotions. They were always there for me. And I will be forever grateful for, I learned a lot from that experience. But yeah, I have a lot of great people in my life that were very helpful at that point. And I stayed on that till Rosie turned a year old. And then after that, I stopped taking it. I weaned off of it with my doctor's guidance, and I was fine. Everything was going great. We always knew we wanted a third. And I really wanted to keep breastfeeding Rosie, but I did not get started back on birth control, but I did not want to do 2 under 2 again. I knew that. And so we had planned a bigger age gap for our third. And that brings me into my third pregnancy. We had started trying, and again, we got pregnant very quickly. And I took my pregnancy test, and I noticed that, the pregnancy tests weren't getting darker. They were just kind of staying the same, and they would only show up positive in the morning. And I thought that was really weird. I just knew something was wrong. And so that pregnancy ended up ending in a chemical pregnancy. It was about maybe 3 or 4 days later after my positive pregnancy test, I started having some cramping, and what I would describe as just a little bit like heavier period. And so my doctor said, there's nothing to do about the chemical pregnancy. And I still took pregnancy tests, and then they just started coming back negative all the time. And so after that, I was like, okay, I really want to be pregnant now. And I handled it okay, but I just really, really wanted to be pregnant again. And so we tried that next month, and we ended up getting pregnant. And I was so excited. I kind of wanted to redo my last postpartum experience because it was just so difficult. And I almost wanted a redo in a way. But this pregnancy was very different. I felt really sick for about 16 weeks, and the nausea was hard to handle. I ended up taking the Unisom and the B6, and that helped a lot. But just, chasing around 2 toddlers was very draining. And then I went to my 20-week ultrasound. And for this baby, we decided that we were going to do a surprise gender. We didn't want to find out if it was boy or girl. I went to my 20-week ultrasound, and the baby had a cyst in its brain, and the doctor was very encouraging and reassuring. He said, we just need to rescan in 4 weeks, but I'm pretty sure it's nothing. And so I had scheduled around 24 weeks another ultrasound, and I wasn't worried or anything. I even told my husband, you don't have to come to it. It's totally fine. I was very laid back and chill. I was like, I'll just go to it and it's going to be fine. Well, at that ultrasound, they ended up finding that the baby was measuring very, very small. And they ended up saying that the baby had IUGR, or intrauterine growth restriction. And so from then on, I was referred to maternal fetal medicine, and I called maternal fetal medicine, and I begged them to please get me in as soon as they could, because, at that point I only had Google to go to. And so I'm thinking that there's something seriously wrong with the baby. It wasn't growing the way it should. It could be a placental problem. What was wrong? It could be a genetic disorder. And so luckily maternal fetal medicine was able to get me in pretty quickly. And a couple of days later, my husband was able to come to this one, but I had another maternal fetal medicine appointment, and the baby was still measuring in the less than 10 percentile, which was different because my other babies were always around the 60th percentile. And so they had said that it could be just a small baby. That's just their genetic makeup. They're small and it's totally fine. It could be a genetic abnormality or a genetic disorder, or it could be a placental problem. And they wouldn't know until the baby was born. And so they had recommended that I do the NIPT test that tests for the trisomies, things that were non-compatible with life. And we had chosen not to do that this time around because we didn't want to find out the gender. So we said, okay, let's do the genetic testing that we can do. And that all came back fine, but it also had the gender on it. And my husband and I still decided we did not want to find out the gender. And so my entire pregnancy, we left the genetic results in a message in my portal. And how I did not open that message, I don't know, like what willpower I had.
Yeah.
But I did not open it. And every ultrasound, we were like, we don't know the gender. We don't know the gender. But from then on, my pregnancy was considered high risk. And so it got to be a lot. I had 2 to 3 appointments every single week. I had NSTs every week. And so non-stress tests just to make sure the baby wasn't in distress. And then I also had at the maternal fetal medicine office, then on a different day, I had biophysical profiles, which is where they look at like the baby's movement, tone, like practice breathing, things like that. And then they also looked at the umbilical artery blood flows just to make sure there wasn't any obstructions and that the blood between the placenta and the baby through the umbilical cord was flowing well, which mine always looked good. All of those testing was always reassuring, but I would get so anxious leading up to these appointments. And I was always so worried that they were going to find something and then I was going to be induced early because, you know, with IUGR babies, sometimes they say, well, or a lot of times they say, well, the baby is going to grow better outside than inside. And so just anxiety leading up to these appointments. And I didn't even, you know, people said they liked ultrasounds because they got to see the baby, but I did not enjoy them at all. I was always afraid that I was going to be so nervous that my blood pressure was going to be high. And then because of my high blood pressure, I was going to have to be induced. So just a lot of anxiety around the pregnancy. I felt like I couldn't enjoy it. And I didn't really take like any pictures of being pregnant. I didn't really want to talk about being pregnant. It was just a very worrisome time. And so towards the end of the pregnancy, the baby was still measuring small. And because of that, they recommended that I was induced at 38 weeks. And so I really did not want to be induced that, even though it's not super early, I wanted to get as close to full term as I could. And I really wanted to do an unmedicated birth again because I had had such a good experience. And so I spoke with my OB, you know, he was kind of stuck in a hard place too, because he couldn't really go against what maternal fetal medicine was recommending. And so together we decided that we would get as close to 39 weeks as we possibly could while being in the 38th week. And so I was going to, again, come in. I wasn't dilated or effaced at all. And so I was going to come in when I was 38 weeks and 5 days. And I was going to begin the induction, and then hopefully the baby would be born at like 38 weeks and 6 days. And so kind of the same thing as last time. I went in the night before and they started the misoprostol. And I was just really nervous because I was still so afraid that, you know, the baby was going to come out and have some sort of abnormality or something was going to be wrong with it. And so I went in, they started the misoprostol. They put the medicine in the vagina every 4 hours. And this time around, I feel like the misoprostol kind of kickstarted the labor a lot more. And I started having contractions again. And kind of the same thing as last time, I got up and I was moving around and I was trying to like squat into the contractions and like really let them do their job. I was walking in the halls a lot. And again, I brought the comb and everything. And so kind of the same timeline, I was dilated to about 3 centimeters and they couldn't give the misoprostol anymore. And I was regularly contracting, but again, they were not painful. And so my doctor came in at around 8 o'clock in the morning and he did a cervical check and he said, okay, you're about 3 centimeters. And how about I come back at 10 o'clock and I break your water and we'll start Pitocin right now. And so my nurse that was there said, well, you know, she's contracting on her own. I don't really think she needs the Pitocin right now. And he said, you know, okay, that's fine. We'll skip the Pitocin, see how things are at 10 a.m. and I'll break your water and everything. So after that, I got up and I went to the bathroom and I think when he checked me, it kind of broke my water a little bit. He didn't mean to. It was a very fast, gentle check. Like, I don't think he purposely meant to break my water. But it was trickling a little bit. And I told the nurse, I said, I think my water is trickling a little bit. Or if it's pee, I don't really know. She was like, well, it's kind of hard to tell. Well, I'll just mark it as your water broke, but we'll keep an eye on it. So I was standing with the IV pole, and I was doing the squats and the comb and trying to keep my face calm. And I looked at my husband and I was like, this hurts so bad. I know I was getting that hot and sweaty feeling again. And I was like, I don't know if I can do this. Like, I think I might need the epidural. This is horrible. And he was like, Hannah, this is exactly how you were acting with Rose when she was about to come. He was like, I think the baby's coming soon. And I said, no, like, that's not happening. She just checked me. I was 3 centimeters. Like, I can't do 7 more centimeters of this. This is horrible. And I'm like pacing, like it was just, the pain was so intense. And so I said, okay, I'm going to call the nurse back in. And if I'm not at least 6 centimeters, I am going to get the epidural because this is horrible. And so she checked me and I was 4 centimeters. And I said, I want the epidural. Like, this is so terrible. She said, okay, he's waiting for you. Like, I'll call him in here right now. And so he gets in there, he's like getting everything together, and, they sit you on the side of the bed and they kind of hunch you over. And I was having the most painful contractions I have ever felt, but he had this like needle in my back giving me an epidural. So I was like, I cannot move because I don't know if I could be paralyzed. Like, I'm trying to stay as calm and together and quiet and not move as I can. And every time I had a contraction, he would stop what he was doing and let it ride. And then he would start again. But I had about 3 really painful, strong contractions. And on that 4th one, I started to feel the ring of fire again. And I looked at the nurse and I said, I think the baby's coming right now. And she said, well, this position. And I said, no, like, I feel the ring of fire. The baby is coming right now. And then I had another big contraction and I was like, like screaming. I'm like, the baby's coming. Like, at this point, the epidural wasn't even finished. He had like had it in my back, but wasn't able to hook up the medicine. And so they like whip me down and lay me down, take my diaper off that I had on. And sure enough, the baby was crowning. And all I could feel was the intense like ring of fire. And so then at that point, again, it's like there's chaos in the room. They're calling for help, calling for another doctor. And that day, my OB was in the hospital, but he was in surgeries. And so they were like, we need to call Dr. Perry, but he wasn't able to get there. So they had like some random OBGYN that was in the hallway come in. And I really liked her. The room was just like chaos, but in between contractions, she looked at me and she said, okay, my name's Dr. So-and-so. I'm going to deliver your baby. Like, it is so nice to meet you. What's your name? Is this husband? She really kind of like took control of the room and calmed it down and said, okay, like, let's have this baby. And so she said, do you guys know the gender? And we said, no, it's a surprise gender. And she said, oh, I just love those. Like, those are so much fun. And by this point, I'm like, can I have the epidural? Like, please give me the epidural. And they're like, Hannah, we don't have enough time. Like, it's not going to have time. And the anesthesiologist was like, I can give you this like IV push, but I don't think it's not going to have time. And so, sure enough, he pushed this medicine. It didn't work. I still felt everything, but I pushed her out. I don't even think I even pushed her out. It was like more of like the fetal ejection reflex. She just came out on her own. And the doctor held her up and said, okay, Dad, what is it? And my husband said, oh, it's a boy. And the doctor was like, look again, Dad. Like, try again. And he was like, it's a girl. And it was a girl. She was a girl. But I think it was just like all the adrenaline. I don't know. And too, like, little girls are very swollen when they come out down there. Mm-hmm. And so I don't know. But anyways, he announced the gender wrong.
Oh my gosh.
But we were like, oh, so then we were like, oh, 3 girls. Like, oh, it was just so fun. And I was just so glad. I'm looking at her. I'm like, is she look healthy? Like, is she a good weight? And they were like, she looks perfect. Like, and I just wanted to hold her. And I remember thinking she smelled so good. Like, I couldn't stop talking about how good she smelled. And I think the nurse thought that I was weird because I was like, she smells so good. And the nurse was like, oh, okay. I'm like, I don't know. Like, she just smells like flowers. And she thought I was so weird. She's like, maybe it's the hat. And I'm like, no, like, this baby smells so good. And, so, my whole pregnancy, we have been talking about how much she weighs. And so finally I was like, you know what? I do not care how much she weighs because I just want to hold her and she's healthy. She's here. Like I was worried that she wasn't going to handle the contractions well. And she did. And everything was just like exactly what I wanted. And so I just wanted to hold her and I didn't let anybody weigh her. I just held her for like 2 hours. And at first, I was worried if she was so tiny that she wasn't going to be able to breastfeed. And so right when she came out, I had tried to latch her, which she had just came out. Like, she was not ready to eat yet. And so I was a little nervous about that, but I was like, okay, I'm just going to keep doing skin to skin with her. And so I did like 5 more minutes of skin to skin. And then she started rooting and I latched her. And it was just like, I was so happy that she latched. And I nursed her for probably 2 days straight after that. Like, she just wanted to keep nursing. And we checked extra for extra fingers and toes because they said that could be genetic. And she didn't have any extra fingers or toes. And finally, after like 2 hours, I had to get up and go to the bathroom. So I was like, okay, like, you guys can take her and measure her and weigh her and everything. And so they weighed her and she was 6 pounds and 13 ounces, which is like a beautiful weight. That's completely healthy, totally normal for her gestational age. And so my doctor, when he delivered the placenta, though, he did say that the placenta was a little bit on the smaller side and that I had a marginal cord insertion, meaning that, like, instead of the cord implanting in the middle of the placenta, it had implanted on the side of the placenta, and that can cause issues with growth. So, he said, I think that the baby was measuring small, but probably had caught up at the last couple of weeks. But yeah, she's just like the perfect little addition to our family and her sisters. I grew up with 2 other sisters, so I'm just like so excited that I have 3 little girls too that can grow up together. And in preparation, I wanted to get on top of the postpartum depression because, I didn't want to feel like that again. And I didn't want to do that. I didn't want to, I knew this was gonna be my last baby and I really wanted to just like enjoy this postpartum. And so my doctor and I decided that after the baby was born that I would start back up on the SSRI that I had been on before since it worked so well. And so when I came home from the hospital, I started that again. And this has just been like a great postpartum. And we just enjoyed her so much. And she's just, I feel really good. And I couldn't be happier with my little family.
Oh, I love that. That was such a fun story at the end.
Yeah, it's so fun. My husband's like, he did get a vasectomy, but I was like, I just want to keep having babies. Like, I don't want to raise them. Or like, I don't think I want to take care of any more babies, but like, I just want to be pregnant and give birth again.
Yeah.
But he's like, no, that's not going to happen anymore. So
shutting it down.
Yes, we are done with that. But, we're just enjoying them. It's chaos like all the time in my house, but it's really fun.
Yeah, I know how that goes with 3 kids.
Yes.
All right. Well, what resources do you want to share?
Yeah. So the birth hour, of course, I listened like religiously every Thursday to the birth hour. And even though I'm not having any more babies, I still listen to the birth hour just because like I just love hearing the birth stories. And then another thing that I want to touch on is you talk about Airflow breast pumps a lot. Mm-hmm. And my first 2 pregnancies, I did not use Airflow breast pumps. And, I don't even think I got to pick what pump I used. But this time around, I was like, I'm going to check out Airflow. And it was great because, I didn't realize like you literally just give them your insurance information and the doctor and they took care of it all. Yeah. And I got to pick out from like so many breast pumps. And then it's really cool too, because they text me every month when I'm due for more supplies. And all I have to do is like reply. They're like, do you want more like bottles and pumps of supplies? And I'm like, yes. And they automatically send it. In which my first two babies, I had to order those off Amazon and like pay for them.
Right.
And I didn't even know that that was like an option. Same with like the breast milk bags. I would buy them and pay for them with my own money. But now I didn't even know that insurance could cover them. So it's really nice now. They just send them to me and I don't have to pay for them or worry about it. So that has been like, I've like told everybody about that.
Oh, good. Yeah, they make it so easy. It's just totally free.
No,
and
they do.
Your mind doesn't even remember to like replace that stuff either. So like having that reminder to replace the tubes and all that is really nice.
Yes. Which like, I don't even think I honestly did not do that on my first and second.
Yeah, same with my first.
I just didn't even replace them unless I had to. But yeah, so that has been like, it's every month. I have so much supplies. So that's been super nice. And then I just want to say like, I learned a lot through the postpartum experiences that I had, but my biggest piece of advice is just to like talk about the way you're feeling and don't keep those feelings inside. You know, you don't have to suffer alone. And the people that are around you and love you, like they want to help you. And so lean on those people and talk about your feelings and don't be afraid to ask for help because like there's just so much joy that's out there. And, you know, there's hard times too, but there's things that you can do to help yourself. So, but I think that's about it.
All right. Well, thank you. And what's the best way for people to reach out to you?
My Instagram name, it's private, but if people message me, I will respond. It's _Hannah_Fair.
Okay. Great. Well, thank you so much, Hannah, for sharing.
Yes, of course. It was a lot of fun.
Now I'm going to chat with Abigail about all the amazing things they have going on with Zenith Health. Hi, Abigail. Thanks so much for coming on the Birth Hour to talk with me about Zenith Health.
Thanks so much, Bryn. So excited to be here.
Before we get into that discussion, will you tell listeners just a little bit about you and your role with Zenith?
Yes. So I'm Abigail Bertelson. I'm the founder and CEO of Zenith. We're a newer company. We just launched earlier in the spring of 2025 and super excited to share a little bit more.
Awesome. And let's talk about just why you started Zenith and what it is.
Yes, definitely. We actually started Zenith just on the basic premise that it's so wild in 2025 that we still don't have good answers about some of the most basic questions in pregnancy. Things that I'm sure all of the listeners to the pod have gone through at some point. You know, is melatonin okay? What about Robitussin for my cough? You know, is it normal to gain this much weight by week 20? A really topical one that keeps coming up in the last few weeks with all of the discourse around SSRIs and antidepressants, right? Can I keep taking my SSRI while I'm trying to conceive and while I'm pregnant? And there's so much research and data missing, but we just looked at this and thought it doesn't have to actually be this way. You know, there's millions of pregnancies in the US every single year, all of which contain thousands of these little experiences around medicines and symptoms, supplements, quality of life, you know, all of these different aspects of pregnancy. But as an industry, we're not capturing or learning from this really effectively. A fun fact that is not that fun that I like to share is many people are surprised to learn that women weren't even required to be in clinical trials until 1993. Yeah. And pregnant women today are still excluded from trials pretty much altogether, which just means we have a ton of ground to make up on the research side in women's health generally, but particularly within pregnancy. And so what we've done is we've created 2 tools that moms can actually use in their pregnancy journeys for a little bit more peace of mind and to help empower other moms in the future with better data. So the first one is actually what we're calling the Pregnancy Evidence Project. It's a fully opt-in research study. It's fully observational, which means the cool thing is that you can actually contribute to research without changing anything about what you're doing or trying any experimental treatments, which is the beauty of learning from real-world experiences. And the second is what we're calling Penny. which is our personal pregnancy evidence navigator, hence the nickname for Penny. And you can ask Penny essentially any of your pregnancy questions wherever and whenever they come up to see the latest data and evidence. So Penny can help you cut through all of the noise of navigating across social media and Google searches and your friend's sister who just had a baby and did that thing and the baby was fine. So really trying to bring a bit more of the latest and greatest research papers and clinical guidelines and physician-authored content to be more accessible and readily available to moms.
Very cool. So how have you seen people using Penny so far during pregnancy?
Yeah, we've seen lots of women turning to Penny for the late night panic Google type of questions. You know, I'm trying to fall asleep. Can I take this melatonin? Things like my symptoms went away. Should I be super worried about that? You know, am I having postpartum anxiety or is this the normal baby blues? And a lot of moms have shared with us that it's super helpful to get these responses kind of in real time, assuage the immediate fear, and then actually share the link and share the response that they're finding with their trusted team, whether that's their partner or their spouse, you know, a doula that they might be working with, a midwife or an OB, to actually inform a more detailed discussion about their concerns or questions, because it's often kind of a two-sided thing where you want that immediate reassurance, but that doesn't fully, you know, answer your question, or you might want to continue talking to your provider about it. And so in that vein, we've actually also been working with a lot of doulas and other birth workers who have themselves found Penny to be a really helpful tool in pulling, you know, lots of evidence and kind of research papers in response to questions from their clients, or helping share Penny with their clients when they first get started as that kind of additional line of defense for, you know, the random times at which these questions often come up.
Right. So it's kind of like asking like Chat GPT, but it's only pulling from evidence-based research, right?
Exactly. So it's only pulling from kind of our library of studies that we think are good, clinical guidelines, things that the American College of Obstetricians and Gynecologists is recommending. So we want it to be really that trusted source to get stuff that is high quality.
Yeah. And you mentioned postpartum. So is this something that supports people from like all aspects of trying to conceive, pregnancy, postpartum, or what's kind of the guideline there?
Yes, Penny is best for women who are currently pregnant, but we can also pull evidence around postpartum experiences. So we actually see a lot of folks use this for questions around breastfeeding and lactation exposures, as well as postpartum mental health questions and things like that. And we also support evidence focused on fertility and trying to conceive. So a lot of moms have questions about what to do in preparing for this pregnancy journey, which Penny supports as well. And the Pregnancy Evidence Project, which is the research side of things, also supports postpartum. So you can join even if you've already had your baby and share a little bit more about your experience after the fact.
Very cool. So speaking of the Pregnancy Evidence Project, how does that work? Can you just share a little bit more about, you know, some of the things you guys are trying to bridge as far as gaps in pregnancy research?
Definitely. So as I mentioned a little bit earlier, we have a long way to go in women's health research and in pregnancy research. And a lot of this is because women have been excluded from clinical trials for so long, and particularly in pregnancy. And so our goal is really to learn from all of the things that are already happening today. We think it's this total misnomer that people say there's no data, we can't answer these questions, because we all probably know 10 moms who have made 10 different decisions on any given intervention or question, or had 10 versions of the same symptom. And so really how this project works is women can decide whether or not they want to opt in. It's fully optional. All of the data is completely private, firewalled, and segregated from the question asking side. So there's no, risk of your data being exposed to advertisers or used for marketing. It is purely governed by an institutional review board research project. And women can basically share brief surveys on a weekly and trimester level basis, just talking about their symptoms that week, their quality of life, any major exposures they had. So things like women with chronic conditions who might be continuing medications that they're using, acute issues or, illnesses that come up during pregnancy, asking women if they took, for example, Zofran for nausea or, Unisom or B6 or some of these really commonly used remedies. And women can also consent to share their medical record data so that ultimately we have this very robust data set that looks at experiences and health outcomes for mom and baby at birth so that we can all answer the question that's on everyone's mind, which is really, does doing X affect how baby is going to feel and how baby is growing and how mom is going to feel. And so we're really excited because we think that by taking this approach, we can get to much more scale than, any of the research projects that have really happened in pregnancy before, so that we can finally have high enough sample sizes to power really, really interesting analyses around how other moms are going through pregnancy and being able to share that information back with both moms, but also researchers and the teams that are trying to publish, hopefully, better research on this for the future.
Yeah, this is so exciting. It feels very grassroots, and I love that anyone can get involved. And where can people go to do that?
Yeah, definitely. People can check out our website at www.zenithhealth.io. That's a great landing page to check out either Penny if you have a question that you want to ask, or start getting involved with the Pregnancy Evidence Project. The Pregnancy Evidence Project does have a fairly lightweight, what's called informed consent process. So we want to make sure that as people are joining, they're fully aware of what they're signing up to, how their data is going to be used and protected, how it will be used kind of down the line. And once you do that, you can start submitting surveys and sharing your experience.
Awesome. And with the Penny aspect, there's no cost involved with that, right?
No cost. One of our core values of the company is that we really want to make all of this information more accessible and transparent to moms. It's really frustrating to see sometimes the cost associated with getting access to better knowledge and, finding a research paper, but it's behind a $75 paywall. So it's really important to us to democratize this access for folks who are looking for really good information.
Yeah, that's amazing. Well, I'm so glad I got to hear more about this and share with my listeners, and I'm excited to see where everything goes with Penny and with the project.
Awesome. Thank you so much, Bryn.
Yeah, thank you. Thanks again to Hannah for sharing her birth stories with us, and to Zenith Health for sponsoring this episode. You can get more information from today's episode by going to thebirthhour.com and searching for Hannah's name in the search bar. And then if you want to check out Zenith Health, you can find that at zenithhealth.io or by searching for it in the App Store. I will link to all of those things both on the show notes and in the podcast app where you're listening to this episode. Thanks so much for listening. If you enjoyed today's show, head to thebirthhour.com and click Become a Member to pledge your support. And as a thank you, you'll get an invitation to join our private Facebook group and access to exclusive episodes. Your vote of confidence and support means the world to me.